everyone, my name is Jordan Redmon. I am a pelvic health specialist located at KORT Brannon Crossing. I have been with KORT for about 4 years, and I have started specializing in pelvic health about 3 years ago. So I went to UK for PT school, and then after PT school I took a couple of continuing ed courses in order to help this population. I hand it over to you.
And my name is Matthew Berry. I'm a physical therapist with the KORT location in Lawrenceburg. I've been with KORT for about 10 years now, and just recently got my certification in male pelvic health certification. An area that I had a lot of patients previously that had complaints, and so just an area that I wanted to be able to help as opposed to referring them out or sending them back to their physician. And so just an area that we're really passionate about here at KORT.
So just to let you guys know, we have Amy and Holly behind the camera. They're gonna ask us a couple questions, but if you guys have any questions or comments, just feel free to type it in. Also, if you have anything personal or private that you want to talk about to us personally after, we will write our emails in on the comment box at the end of this video.
Perfect. So first of all, just what overall in general, what is pelvic health dysfunction?
Okay, so the question is, what is pelvic health dysfunction? So your pelvic floor is a group of muscles located in the pelvis, and they kind of stabilize and hold everything together. They also control all bowel, bladder, and sexual function. So if you are having any signs or symptoms related to one of those areas, it could be due to dysfunction in pelvic floor.
Perfect. So for Jordan, for you on the female side, because now you treat women, what are some of the causes of pelvic health dysfunction?
Yeah, so what are the causes of pelvic health dysfunction? So it usually falls into one of two things. You can have tightness and overactivity of the pelvic floor. So that's when the muscles can't turn off or turn on all the way, and they just stay in this mid-ring contracted state. Then on the other end of the spectrum, you can have muscles that are a little bit loose or weak, or they're not coordinated. And depending on what your signs and symptoms are, it's going to be according to one of those things. You can also have a little bit of neurological dysfunction. So that's going to be things like overactive bladder or frequent urination. So there's kind of dysfunction between the bladder and the brain connection.
And then Matt, maybe on the male side, what do you see more of the causes?
Yeah, one of the common areas that we actually see are our post-cancer population that we see. Patients that have been treated for either prostate cancer, bladder cancer, on the female side, uterine cancer. Also some of our trauma-related patients. We see patients that have had issues following motor vehicle accidents, ATV accidents. Even athletes following sports-related injuries can have issues with pelvic floor dysfunction.
Awesome. So what would be some of the signs and symptoms of dysfunction? Jordan, we'll go with you first.
Sure, so signs and symptoms of pelvic floor dysfunction. So let's just say you fall into the category of overactive or a tight pelvic floor. Signs and symptoms of that are going to be difficulty starting the stream of urine, or the feeling like incomplete emptying when you're done, or if you go to sit up or stand up from the toilet and you have a little bit of dribbling of urine. That can be signs of tightness or overactivity. Other things could be constipation, so you're not able to relax your pelvic floor and have a bowel movement, or pain with intercourse. That can all be tightness related. Then on the other end of the spectrum, you can have weakness. I think the biggest sign of pelvic floor weakness that I see is incontinence. So you can have both urinary and fecal incontinence. So that's any amount of leaking. In terms of urination, it can range from a couple drops of urine to fully losing urine. And any amount is abnormal. And I think that's a big thing to stress to my patients, because I have a lot of them come in to me and they're like, well, I've been having it for 30 years now, and my doctor says that's normal because I'm aging and I've had kids, but I just want you guys to know that any amount is abnormal, and a pelvic floor PT can help. Other signs of weakness would be a prolapse. So a prolapse is just when tissue is kind of falling down. So it can be either the bladder, the uterus, or even parts of the rectum kind of fall down into the vaginal area, and that's going to feel like pressure or like a falling out feeling, and that can be helped with pelvic floor PT as well. Another big population that I see is women postpartum, so they can have a little bit of abdominal separation after having a baby, or if they just want to come see me before they return to exercise. That's a big population that I treat. And then another one is just the neurological dysfunction between the bladder and brain. So overactive bladder, frequent urination. A lot of my patients are going to the bathroom 3 to 4 times at night, or if you feel like the amount of times your frequency is interrupting your daily life, then you should really seek out a pelvic floor PT.
Love it. And Matt, on the male side, what do you see as the causes?
Yeah, similar to what Jordan had said is also patients that have either maybe chronic low back pain issues. It was actually an area of focus that really brought me into the male pelvic floor specialty. Were patients that had been treated for, reoccurring low back pain, chronic low back pain, and unfortunately all of the regular courses of treatment had been unsuccessful. And so, patients that have really felt like they didn't have a whole lot of options, those are patients that we really wanted to try to reach out to, patients that we really wanted to try to be able to help. So
Definitely. What can I expect my first appointment and then during therapy in the clinic? Jordan, you want to take that one?
Yeah, so what can you expect on your first appointment? So the first day is really a lot of time getting to know each other. So I will ask you a lot of personal questions and just try to figure out what's going on, what your biggest complaints and concerns are, what you want to get out of PT. After that, I do a general musculoskeletal exam. So I'll look at range of motion of the lumbar spine, I'll look at abdominal and hip strength. I might kind of palpate the different muscles and see if there's any tenderness. Then closer to the second visit, I'll likely do an internal assessment, and that's similar to what happens at the OBGYN. That is something that is completely up to the patient, and if they don't feel comfortable with that, that's completely fine too, and we can work around it. Following that, I'll just likely prescribe a lot of exercises depending on what the patient needs. So each visit lasts about an hour, and it's in a private room, so you don't have to worry about that. And then a lot of times I see my patients once a week, but every now and then I do see a patient twice a week.
And Matt, same for you on the
similar frequency, usually starting out at a frequency of twice a week and then decreasing down based on symptom management.
Right,
So.
and then I guess overall, how many visits does this average to see results?
Yeah, so how many visits does it take to see results? That is something I see really fast. So in terms of incontinence, I can see that within improvements within a week. And I think part of that is just giving the patient the knowledge on what's normal and what is normal bowel and bladder function. And knowledge is power for my patients, so they can see results quick. Then on the other end of the spectrum, when it comes to real strengthening, so fixing a prolapse or postpartum women gaining their strength back, that can take closer to like 4 to 6 weeks to see really big improvements. So it really depends on the condition.
Perfect. So how quickly can I get scheduled for a pelvic health appointment, and how would I find a clinic?
Yeah, so we get our patients in within a week, which is just a huge deal because if you call other pelvic health places in town, it's likely a 6 to 8 month wait list. So we're really proud of ourselves here at KORT. We recognize the need and how important it is to get these patients in. So there's a couple of different ways you can get scheduled. You could either call the closest KORT to you and we can refer you and we'll know which location has a pelvic health specialist. Or you can go to our 800 number, that's 1-800-645-KORT. Or you can go to our website, KORT.com, and they have a chat box and we can get you in the clinic through that.
Perfect. And then Matt, is it covered by insurance, pelvic health?
Yeah, pelvic health rehab is covered by insurance just like any other physical therapy treatment protocol. Depending on whether you're referred through a federally funded plan or if you're a commercial insurance, the best way to do that is just to contact the clinic, and what we can do is we can recommend whether because of direct access you may be able to go ahead and schedule an appointment, or it may be best for you to go ahead and schedule an appointment with your physician. And so if you can just reach out to one of our clinics, we can divert you where the best method would be possible.
Perfect. Then Jordan, I know you're treating now clogged milk ducts for breastfeeding mothers. Can you talk more about that process and how that works?
Yeah, so that's something I started treating earlier this year after getting hooked up with a lactation consultant. We just have realized how important it is, and there's a lack of care for these women. So we started using ultrasound as a modality to clear the clogged duct. So the ultrasound waves help break up the clog. Now, the best results I'm seeing is when the patient gets in as fast as possible. So the minute you start to feel a clog coming, you want to call that morning and we will get you into one of the clinics within 24 hours. The treatment session is really easy. We'll do a little bit of manual therapy to help facilitate drainage of the clog, and then ultrasound and end with moist heat. We like to do back-to-back days, so you'll want to come two to 3 days in a row depending on how severe the clog is. And then research shows within 5 days after the last session, the clog should go away. So yeah, if you have any questions, please feel free to reach out to me about that.
Can you explain too, maybe so for a new mom might not know what that feels like? So what?
Yeah. It's not painful at all. So the ultrasound, it feels exactly like what you had when you went to your OBGYN appointment. So you might feel like a warm, tingly sensation, but it's not painful or anything like that.
And then also, how would they know that maybe they're in trouble or need to see you?
Yeah, For women who have never had a clogged duct, or they're just starting their breastfeeding or exclusive pumping journey, the clog will feel really tender, almost like a knot in the breast tissue, and that can range in size from like a marble, and then I've seen larger ones, like a golf ball size. But it's definitely something that you want to seek treatment quick, because if it goes for a long period of time, it can turn into mastitis, which can be really dangerous. Yeah.
Okay, awesome. Do we have any questions on the chat?
Not really, but I have one.
Oh.
You talk about going too often. How do you know you're going too often? Is it just if it interrupts your daily life, if you can't get in the car without going? What is...
Yeah, so I see some women, I've seen women go up to like 20-something times a day. So normal frequency is 5 to 7 times a day, and then about once at night. So if you're going much more frequently than that, it can be fixed. That's when I'll go into like dietary irritants with somebody, or urge suppression. So if you feel like you're going so frequently, like every hour, or like you can't go to lunch with your girlfriends without going to the bathroom, or the minute you walk into Kroger, you're like, oh wait, let me find out where the bathroom is before I get started. Or if you're going just in case, you're like, I'm gonna go run a couple of errands, let me go to the bathroom really in case. That's abnormal, and you don't want to be doing that. So that's going to work on a lot of urge suppression and kind of retraining the bladder. Yeah, that's a good question.
You touched on the constipation. Can you talk more about how you would help treat with that for males?
Yeah, absolutely. We do a thorough palpation examination, just looking at, maybe abdominal tenderness, some treatment options that we utilize. We utilize electrostimulation modalities for relaxation techniques. We've done cupping, we've done dry needling, soft tissue massages just to try to move the bowels. A lot of patient education on proper ways to successfully contract and relax the pelvic floor musculature, using different types of feedback options that may range from self-palpation examination to even mirror therapy. And so, just ways that you can visualize what is going on as far as that musculature, and ways that you can re-improve the communication between those muscles in your brain.
Awesome. Well, thank you both. It's an exciting program. You want to tell me again how they can make an appointment in the
Yeah, so there's 3 different options for patients. So you can come in the clinic. We're all wearing masks and sanitizing like crazy. We're also doing tele-rehab. So if you don't feel comfortable coming in the clinic, but you still want to see us, we can do it through video. We might ask you to come into the clinic just for that second visit for the internal assessment, but then we can transition you back out to tele-rehab. And then our last option is in-home therapy. Now, unfortunately, Pelvic Health does not cover in-home therapy, but if you are a patient like post-op, a joint replacement, or for some reason you can't make it into the clinic, we do offer in-home therapy for those conditions. You can reach out to the clinic specifically if you want to get scheduled, or you can go to 1-800-645-KORT or KORT.com. Also, if you have any questions for us, we are going to write our emails in the comment section, or you can feel free to ask us any questions now.
Awesome. Thank you both.
Bye.
Thank you.